Hello, I'm Marianne Ivie. I'm the System Director of Infection Prevention. I'm often asked, what do infection preventionists do? Many people think that infection preventionists spend the majority of their time doing surveillance. But in reality, infection preventionists are involved with all aspects and areas of the hospital, from the OR to the kitchen, from the ICU to the back dock, and everything in between. Infection preventionists possess a unique knowledge base and skill set, and they're involved in a myriad of activities, including patient safety, quality, regulatory compliance, and performance improvement. An infection prevention mentor of mine often says that infection prevention is the moral compass of the hospital. I believe that, and I try to live that every day. The pandemic has provided a unique opportunity for infection prevention. And the infection preventionists in our Baptist system have risen and exceeded the challenge. It is my pleasure to work beside this outstanding team of infection preventionists each and every day. And I salute every one of them. And now it is my pleasure to introduce our Medical Director of Infection Prevention for the system, Dr. Steve Threlkeld. Dr. Threlkeld supports infection prevention every day, and we are so grateful for his partnership and his leadership.
Hi. We all know how important our infection control team is, really at all times and in everything we do in the hospital and beyond. Crucial, truth be known, to those of us who know the truth. But I think over the last year and a half particularly, there's been an extra special need for our infection control team, and there's been an extra special effort on the part of that team to rise to an occasion that none of us has seen throughout our lifetime. It's been extraordinary, the lives that have been lost, the pain that has been suffered by both patients, family members, and our friends in the community. And I think what's sometimes difficult for us that working in the infection control area is that you haven't been credited with enough, really, for what you have done to save lives in our community. But unfortunately, that's always the way it is with infection control. It takes a special breed of person to get involved in this kind of work. People don't necessarily always see what you're doing on the sidelines, behind the scenes, but we all know the importance of it. Many, many lives have been saved from practicing the proper techniques with personnel in the hospital, from tracking down people who've been exposed to this virus, protecting them, getting them into treatment. There are just a number of ways in which you have risen to the occasion. So we all know that really you need more credit than you get, and it does indeed take a special person to do that anyway. But from all of us who work with you on the front lines, we are eternally grateful from the work that you have put in to help save lives, to protect all of us, and we love you all very much.